I made this video especially for the women who come to see me every day in search of answers. Women who have often spent years going from doctor to doctor, specialist to specialist, having blood tests, scans, and investigations, only to be told that everything is normal. Women who have started to wonder whether they are going mad, whether it's all in their mind, or whether they are somehow imagining their symptoms. Women who are simply desperate to feel better and desperate to understand what is happening to their bodies. If that's you, I first want to say this to you. You are not alone. Whilst not everybody with these symptoms has Mast Cell Activation Syndrome or MCAS, today I want to explain one possible biological pattern that I see very commonly in my clinical practice. My hope is that by the end of this video, you'll have a much better understanding of what may be happening inside your body, and perhaps for the first time in a very long time, some of the pieces of the puzzle will finally start to fit together. Everything I'm going to discuss today is for education. Mast Cell Activation Syndrome is a complex condition with overlapping symptoms, and not everyone with these symptoms has MCAS. My aim is to help you understand one possible explanation that you can discuss with your healthcare professional. Let's start with one of the most important cells in your immune system, the mast cell. I want you to imagine that your body is a beautiful house. Every house needs protection. Standing at the front door is a loyal guard dog called Mast. Mast represents your mast cells. Mast cells are not bad. They are not trying to hurt you. Without them, we simply would not survive. They are your body's security guards, constantly watching for danger 24 hours a day. They live almost everywhere in the body, but they are especially concentrated wherever your body comes into contact with the outside world. They sit in your skin, they line your nose, they line your eyes, they line your lungs, they surround your blood vessels and nerves. But one of the places where they are found in the highest numbers is your digestive tract. Many people think that once they swallow food, it is inside the body, but technically it isn't. Imagine your digestive system as one very long tube running from mouth all the way to your back passage until food crosses the incredibly thin wall of your intestine and enters your bloodstream. It is still technically outside your body. That means your gut is one of the biggest borders between your body and the outside world. Every day it has to decide what is safe to allow through and what should be kept out. That's why mast cells are stationed there in such large numbers. They are standing guard, checking everything that comes through, every visitor before they are allowed to enter. Under normal circumstances, mast is an excellent guard dog. Imagine a burglar smashing a window and climbing into your house. What do you want your guard dog to do? You want him to bark loudly. That bark alerts the whole neighborhood that danger has arrived. In exactly the same way mast cells recognize genuine danger, they respond to bacteria, viruses, parasites, venoms, toxins, allergens, physical injury, surgery, and burns. They even help repair damaged tissues and wounds. They are doing exactly what they were designed to do. The problem begins when the guard dog becomes overprotective. Instead of barking only at burglars, he starts barking at butterflies. He barks at flies. He barks at leaves blowing across the garden. He barks at the postman. He barks at the neighbor walking past the gate. He barks at shadows. He barks when there isn't actually any danger at all. That is a simple way of understanding mast cell activation. The mast cells become much easier to trigger than they should be. We don't always know exactly why this happens. Some people appear to have inherited a tendency. Others notice it begins after a viral illness. Some after significant stress or trauma. Others after surgery. Others notice it around a pregnancy, perimenopause, or menopause, when hormones are changing dramatically. For many women, there isn't one single cause. It's usually a combination of factors that slowly build over months or years. One of my favorite ways of explaining this is what I call the histamine bucket. Imagine every single stress on your body adds a cup of water into a bucket. A poor night's sleep adds some water. Emotional stress adds another cup. An infection adds another. Hormonal fluctuations add another. Heat, cold, exercise, alcohol, certain medication, strong perfumes, pollen, dust, mold, certain foods, they all add a little more water. Eventually, your bucket becomes so full that one final trigger causes it to overflow. Then patients tell me something I hear almost every day. Dr. Purity, I ate that food last week and I was absolutely fine. Exactly. Last week, your bucket wasn't full. Today, it overflowed. That's why mast cells can seem so confusing and so unpredictable. It often isn't one trigger, it's the total load your body is carrying at that moment. Every time mast barks, it releases chemical messengers called mediators. Histamine is the biggest known and most abundant, but it is only one of hundreds of mediators released by mast cells. They also release prostaglandins, which contribute to inflammation and pain, leukotrienes, which can tighten the airways and increase inflammation, asthma-like symptoms, heparin, a natural blood thinner, which causes easy bruising, small amounts of serotonin, which can cause morning nausea, cytokines and chemokines, which call in more immune cells. Think of histamine as your house alarm. The dog barks, the alarm goes off, but your alarm isn't just making noise, it is directly connected to the police, the ambulance, and the fire brigade. They all arrive because they generally believe there's an emergency, but there wasn't a burglar, there was only a butterfly. Your immune system reacts in exactly the same way. Histamine sounds the alarm, more immune cells arrive, more inflammatory chemicals are released, the whole immune system switches into emergency mode. The body behaves as though there is a serious threat, even when there isn't one. One of the commonest things my patients tell me is this: Dr. Purity, I feel like I'm getting a virus. They feel fuzzy headed, muzzy headed. They describe their brain as feeling wrapped in cotton wool. They struggle to think clearly. They can't find words. They walk into rooms and forget why they are there. They feel as though their IQ has dropped by 20 points overnight. They ache all over. They feel poisoned. Their body feels heavy. They lose motivation. They feel absolutely exhausted. They think, tomorrow I'm definitely going to wake up with the flu. Then tomorrow comes and there is no flu. There is no sore throat, no cough, no runny nose. The virus never arrives yet. They still feel dreadful. Why does that happen? Think about the last time you had influenza or COVID. Was it really the virus that made you ache all over? Not entirely. Much of what you experienced was your immune system fighting that virus. The inflammatory chemicals released by your immune system make you tired. They make you lose your appetite. They make your muscles ache. They make your brain feel slow. They make you want to crawl back into bed. In mast cell activation, your immune system may release many of those same inflammatory chemicals, even though there isn't actually a virus to fight. So you generally feel as though you're coming down with something, but nothing ever arrives. You go to bed hoping tomorrow will be better, yet you wake up feeling completely unrefreshed. It's as though somebody forgot to recharge your batteries overnight. This is why so many women tell me, Dr. Purity, I wake up more tired than I went to bed. Over time, many receive diagnoses such as irritable bowel syndrome, fibromyalgia, or chronic fatigue syndrome. These are real conditions with complex causes, and mast cell activation certainly doesn't explain every case, But in my clinical experience, I increasingly find that mast cell activation can be an important piece of puzzle in some women because mast cells live almost everywhere in the body. When they become overactive, symptoms can appear almost anywhere. In the next part, I'm going to show you exactly how one tiny immune cell can explain symptoms affecting the brain, the heart, the gut, the skin, the hormones, the joints, the nervous system, and why so many conditions seem to travel together. Now that we understand our guard dog called Mast, let's walk through the house and see what happens when it keeps barking unnecessarily. Remember, mast cells live almost everywhere in the body, so if they become overactive, almost every organ system can be affected. This is why mast cell activation can look like 10 different diseases, when in fact there may be one underlying process connecting them all. Let's start with the brain because it is often a symptom that frightens most of the women. Many women tell me, Dr. Purity, I don't feel like myself anymore. They develop brain fog, they can't think clearly, they forget names, they lose words halfway through a sentence, they walk into a room and can't remember why they went there, they start reading a page in a book only to realize they haven't taken in a single word. They become easily overwhelmed. They can't multitask like they used to. They lose confidence in themselves. Some begin to wonder whether they are developing dementia. Others are told it's anxiety. Anxiety can certainly exist on its own, but inflammatory chemicals released by mast cells can also influence the brain and nervous system, making some people feel constantly on edge. Some women experience panic attacks, others become unusually irritable, some become angry very quickly. They shout, they cry, they react in ways that are completely out of character. Afterwards, they often feel guilty because they know that wasn't really them. The body has simply been stuck in survival mode for so long that the nervous system has become exhausted. Some women become very sensitive to noise, others become sensitive to bright lights, strong smells become overwhelming, busy shopping centers suddenly feel unbearable. The brain is constantly scanning for danger because the guard dog keeps telling the body that danger is everywhere. Then come the headaches. Many women develop frequent headaches or migraines. Some develop pressure behind the eyes. Others experience dizziness or lightheadedness. Some describe feeling as though they are walking on a boat. Ringing in the ears, known as tinnitus, is another symptom I hear about frequently. Then we move to the heart. Many women experience palpitations. They suddenly become aware of every heartbeat. Their heart races for no obvious reason. Sometimes it happens after eating, sometimes after exercise, sometimes when they lie down at night. Some women also have a condition called posterior orthostatic tachycardia syndrome, or POTS. When they stand up, their heart rate rises excessively because the autonomic nervous system struggles to regulate blood flow properly. They feel dizzy, weak, and shaky. Sometimes they feel as though they might faint. POTS, hypermobile spectrum disorder, and hypermobile Ehlers-Danlos syndrome frequently coexist with mast cell activation in clinical practice. We don't yet know exactly why they occur together so often, but many researchers believe there may be a shared biological mechanism in at least some patients. Then we come to what I call the bendy group. Many of these women tell me they were incredibly flexible as children. They could do the splits, bend their thumbs back to their wrist, hyperextend their elbows and knees. They were always called double jointed. Then, as they became older, they became stiff instead of flexible, but the underlying connective tissue differences remained. That connective tissue isn't just found in your joints, it's found throughout your blood vessels, your gut, your bladder, and many other organs, which may help explain why symptoms occur in so many different body systems. Then we move to the ears, nose, and throat. Chronic sinus congestion, recurrent sinus infection, post-nasal drip, itchy ears, itchy throat, sneezing for no obvious reason, feeling blocked one day and completely normal the next. The eyes may become dry, itchy or watery. The mouth may become dry. Then we arrive at the digestive system, one of the busiest homes for mast cells in the entire body. Many women develop reflux, bloating, excessive wind, cramping, nausea, morning nausea even before they've had their breakfast, diarrhea, constipation, or alternating bowel habits that have often been labeled as irritable bowel syndrome. They begin reacting to foods they previously tolerated perfectly well. They become frightened to eat because they never know what their body will do next. Then there is the skin, flushing, hives, itching, eczema, dermatographia, and this is where simply scratching the skin leaves raised welts or hives. Some become excessively sweaty, others develop hot burning feet, and this usually happens at night. Some flush after drinking wine or eating certain foods. Others notice sudden hot flashes immediately after eating, which can sometimes be difficult to distinguish from menopausal flashes because both may occur together. Then there are the muscles and joints, generalized aching, stiffness, pain that seems to move around the body. Some women are diagnosed with fibromyalgia, others with osteoarthritis at a surprisingly young age. Again, these conditions are complex, and mast cell activation is not the explanation for every patient, but chronic inflammation can certainly amplify pain pathways and make existing musculoskeletal conditions feel much worse. Many women also notice that their symptoms fluctuate dramatically with their hormones. They feel worse around ovulation, worse before their period, worse during perimenopause when hormones levels become unpredictable. Estrogen can influence mast cells, and mast cells can also influence hormonal signaling, creating a vicious cycle in susceptible women. This is one of the reasons I often introduce hormone replacement therapy carefully in women who have significant mast cell activation, because sometimes we need to calm the guard dog first before asking him to cope with hormonal changes. Another important overlap I see in clinical practice is neurodivergence. Many women with mast cell activation also tell me they have ADHD or autistic traits, or they have children with ADHD or autism, or they may not even know that they have neurodivergence. Others have endometriosis or polycystic ovarian syndrome. These conditions do not necessarily cause one another, but they frequently coexist, suggesting there may be overlapping biological pathways in at least some people. When I meet a woman with brain fog, anxiety, IBS, migraines, joint hypermobility, food sensitivities, flushing, palpitations, poor sleep, endometriosis, ADHD, hypothyroidism, or autoimmune conditions, I don't see 10 separate conditions. I step back and ask myself one question: could there be one overactive guard dog barking throughout the entire house? In the next part, I am going to explain why symptoms often become worse in the evening and overnight, how mast cells drive adrenaline, cortisol, and how visceral fat becomes involved, why weight loss becomes so difficult, and how all this can be a vicious cycle that keeps the body trapped in inflammation. Now we need to understand why so many women tell me, Dr. Purity, I feel worse in the evening, or I wake up at 2 or 3 o'clock every morning and I cannot get back to sleep. Histamine doesn't just affect allergies. Histamine is one of the chemicals that helps keep your brain awake. It's an excitatory neurotransmitter. Think of it as someone continually pressing the accelerator pedal in your brain. If your muscles are releasing excess histamine, your brain can become over alert when it should be winding down. Your body begins behaving as though it is constantly scanning for danger. That means your fight or flight system never truly switches off. Fight or flight is a wonderful survival mechanism when you're being chased by a lion, but your brain releases adrenaline, your heart beats faster, your breathing becomes quicker. Blood is diverted away from digestion towards your muscles so you can run. Once the danger has passed, your nervous system should settle and your body should return to rest, repair, and digestion. But imagine if the guard dog keeps barking all day, every day. Your brain never receives a message that everything is safe. It continues releasing stress hormones. Adrenaline rises, then cortisol follows. Cortisol is a life saving hormone because it helps us survive stress. But cortisol was never designed to stay elevated for months or years. When cortisol remains persistently high, it begins changing the way your body works. Blood sugar rises because your brain believes you may need extra fuel to escape danger. Insulin rises to deal with that extra glucose. Over time, your cells become less responsive to insulin, a process known as insulin resistance. Falling estrogen during perimenopause and menopause makes this even more likely. At the same time, fat storage changes. Instead of storing fat mainly around the hips and thighs, more fat is deposited deep inside the abdomen around the internal organs. This is called visceral fat. Visceral fat is very different from a fat that is just under the skin. It isn't simply stored energy, it is an active endocrine and immune organ. It produces inflammatory chemicals, including interleukin 6 and human necrosis factor alpha. It releases free fatty acids into the circulation, worsening insulin resistance. But perhaps most importantly, visceral fat contains high levels of an enzyme called 11 beta hydroxysteroids, dehydrogenase type 1 or 11-BHSD1. This enzyme converts inactive cortisone back into active cortisol inside the fat tissue itself. In other words, visceral fat creates its own local cortisol factory. Cortisol then encourages even more visceral fat storage. More visceral fat produces more inflammation and more cortisol. That leads to even greater insulin resistance and even more fat accumulation. That cycle keeps feeding itself. This is one of the reasons stubborn weight gain during midlife is so much more complicated than simply eating too much. It is biology, it is hormones, it is inflammation, it is stress physiology. This is why I often say that cortisol can become the weight loss thief. It steals your ability to lose weight by changing the biology of your metabolism. Then there is another piece of the puzzle that sits right in the middle of all this, and that's the gut. Remember, I told you that mast cells are heavily concentrated along the gut lining because it forms one of the biggest borders with the outside world? Yes, your intestinal wall is only one cell thick. Imagine trying to make a garden hose out of knitted wool instead of solid rubber. When water flows through it, water sprays everywhere through all the little holes. Leaves, dirt, and debris would also find their way through. That is a useful picture for understanding increased intestinal permeability, sometimes called leaky gut. When the gut barrier isn't functioning optimally, larger food particles, bacterial products, and other substances may interact more readily with the immune system, waiting just beneath the gut lining. Mast cells are sitting there just like guard dogs at the border. The more they perceive danger, the more likely they are to sound the alarm. And another important player is an enzyme called diamine oxidase, or DAO. DAO helps break down histamine within the gut before it can be absorbed. If histamine intake is high, histamine production is increased, or DAO activity is reduced, then the overall histamine burden may rise. Again, think back to your histamine bucket. It is the total load that matters. So how do we calm the guard dog? The first thing to understand is that we are not trying to get rid of Mast. Mast is not the enemy. He has spent his whole life trying to protect you. Our job is simply to teach him the difference between a burglar and a butterfly. That takes time, it takes patience, and it usually requires us to reduce the total inflammatory load on the body rather than looking for one magic tablet. The first place I usually start is by reducing the amount of histamine the body has to deal with. This is why I often recommend a structured 6-week low histamine reset. This isn't designed to be a restrictive diet forever. It is simply a way of giving your immune system an opportunity to settle down while we begin calming the guard dog down. During these 6 weeks, many women notice their brain becomes clearer, their bloating improves, their sleep improves, their anxiety settles, their skin becomes less reactive, their headaches become less frequent, their bucket slowly begins to empty. Fresh food is incredibly important because histamine naturally increases as food ages. The longer food sits in the fridge, the more histamine can accumulate. That's why I often say fresh is best. Cook fresh when you can. Freeze leftovers promptly rather than leaving them in the fridge. Learn your own triggers because no two people are exactly the same. Some women react to one food while another tolerates it perfectly well. This is not about creating fear around food, it is about understanding your own body. We also need to improve the health of the gut because a healthier gut barrier means fewer unnecessary alarms being triggered. Good sleep becomes essential because every poor night's sleep adds another cup in that histamine bucket. Managing stress is equally important because emotional stress is interpreted by the immune system as another potential threat. Gentle movement can help, but if your body is severely inflamed, pushing through exhaustion often makes people feel worse rather than better. Sometimes we also use medications. Antihistamines don't stop mast cells releasing histamine, but they block histamine attaching to its receptors. Imagine histamine as a key looking for a lock. The receptor is the lock. An antihistamine sits in the lock, so histamine cannot fit properly. The alarm signal becomes quieter, and some people benefit from H1 antihistamine. Others also require H2 blockers because histamine has different receptors in different tissues throughout the body. The choice of medication always depends on the individual and should be discussed with your doctor. I also commonly use supplements as part of a broader management plan. Quercetin is a naturally occurring plant flavonoid that may help stabilize mast cells in some people. Vitamin C plays an important role in immune health and also helps metabolize histamine. Vitamin D is essential for healthy immune regulation. Magnesium can support the nervous system and sleep. Some patients also benefit from DAO supplements taken with meals to break down histamine within the gut. None of these are miracle cures on their own, but they are simply tools that may help reduce the overall burden when used alongside the right lifestyle changes. Then we come to hormones because this is, after all, a menopause channel. Hormones and mast cells have a fascinating relationships. Many women tell me that they felt worse around ovulation, worse before their periods, worse during perimenopause when hormones levels were fluctuating wildly. Some women are also particularly sensitive when starting hormone replacement therapy. That does not mean HRT is wrong for them. In fact, many women feel dramatically better once we get their hormones balanced. But if the guard dog is already barking frantically, sometimes introducing hormones too quickly can temporarily increase symptoms. This is why I often like to calm the mast cells first before gradually introducing or adjusting HRT in women who appear particularly sensitive. Every woman is different. There is no one-size-fits-all approach. Throughout this video, I've shown you how one tiny immune cell can influence the brain, the gut, the skin, the hormones, the heart, the nervous system, and metabolism. That's why I use the MAST framework in my clinic. M is for migraines, misery, and morning nausea. A is for anxiety, allergies, and often ADHD or neurodivergent overlap. A is for skin, sinuses, and sleep disturbance. T is for tummy, triggers, and timing. I also use my Bendy framework because so many women have symptoms affecting the brain, energy, nervous system, digestive system, and your connective tissue. Finally, I use my FIRE framework because chronic mast cell activation creates a flared immune system, ongoing inflammation, reduced repair, and profound exhaustion. If you recognize yourself throughout this video, I hope you now understand that your symptoms are real. They are not weakness. They are not laziness. They are not a failure of character. Your body has been trying to protect you. It has simply become a little too good at its job. The good news is that once we understand the biology, we can begin calming the system, reducing inflammation, and helping the guard dog feel safe again. We don't want to get rid of Mast. We simply want him to stop barking at flies because when the guard dog finally learns the difference between a butterfly, a fly, and a burglar, the alarm settles, the emergency services stand down, the house becomes peaceful again. And for many women, that is when healing finally begins. Before we finish, I want to talk about one subject that causes a lot of confusion, and that's hormones. Many of the women who find my channel are in perimenopause or menopause. So it's natural to ask whether falling estrogen causes mast cell activation. The answer isn't quite that simple. Hormones and mast cells have a two-way conversation. Mast cells have receptors that respond to hormones, and hormones influence how mast cells behave. During perimenopause, estrogen doesn't simply fall in a straight line. It rises, it falls, it surges, it fluctuates. Those hormonal fluctuations can make an already sensitive guard dog even more reactive in some women. That's why some women notice that their symptoms are much more around ovulation, before a period, or during the hormonal turbulence of perimenopause. It's important to understand that estrogen is not your enemy. Your brain, heart, bones, muscles, blood vessels, and many other tissues rely on estrogen to function well. For many women, the problem isn't estrogen itself, it's the hormonal roller coaster. Rapid fluctuations can make an already overprotected guard dog bark even more. As menopause progresses and estrogen levels fall further, other problems begin to appear. Sleep often deteriorates. The brain loses many of estrogen's calming and protective effects. The bladder and vagina become more vulnerable. Bones begin losing strength. Visceral fat increases. Inflammation may rise. This is one of the reasons why carefully replacing estrogen to restore more stable hormone levels can help many women feel significantly better. Progesterone is also an important part of the story. Experimental studies suggest that progesterone can help stabilize mast cells and reduce the release of inflammatory mediators. This may be one of the reasons many women feel calmer, sleep more deeply, and experience fewer inflammatory symptoms when progesterone levels are adequate. In my practice, when progesterone is needed, I generally prefer body identical micronized progesterone because it most closely resembles the progesterone naturally produced by the ovaries. However, every woman is different. Some women, particularly those with progesterone intolerance, can initially feel worse rather than better. That's why treatment should never be a one-size-fits-all approach. I have also observed repeatedly in clinical practice that some women with significant mast cell activation don't tolerate starting estrogen immediately. They may notice increased flushing, more anxiety, palpitations, poor sleep, feeling wired instead of calm. That doesn't necessarily mean estrogen is wrong for them. It may simply mean that their guard dog is so reactive that almost any hormonal change is interpreted as another reason to bug. In those women, I often focus first on calming the mast cells, reducing the histamine load, and improving sleep, supporting the gut, and lowering the overall inflammatory load before gradually introducing hormone therapy. Once the gut dog becomes calmer, many women tolerate estrogen much better and body identical progesterone much better than they did at the beginning. Every woman is different, and that's why there is no single protocol that suits everyone. Your body isn't trying to harm you, it is trying to protect you. Sometimes it's simply protecting you too enthusiastically. Our job is not to fight your body, our job is to teach your guard dog that the butterfly is not a burglar.